Hello everyone, I'm Raina Smith with Care New England. Many of you at home may be feeling a little stressed and anxious as a result of coronavirus, and Butler Hospital wants to help you cope with the psychological impact of coronavirus and help you manage some of your anxiety. Joining us now is Dr. Uebelacker. She is a psychologist and researcher with expertise in helping people cope with depression and medical issues, including chronic pain and concussion. Thanks for joining us.
Thanks for having me, Raina.
We're so happy to have you here today. Now, tell me a little bit about the emotions people are feeling right now.
Yeah, obviously a lot of people are feeling anxious. Anxiety is totally normal in times of uncertainty. And in some ways, anxiety is important because it motivates us to do things we need to do, like social distancing and hand washing. Of course, people are worried about their health of their loved ones, finances. People are sad about the things they've had to give up. People might be angry about certain aspects of the situation. The key thing about all of these emotions is that they're all expectable, and telling yourself not to feel them doesn't usually work. So if I say, don't worry, oh, okay, thanks, I won't worry, that doesn't usually work. So we need to instead accept that we're going to have all kinds of challenging emotions during this time and do what we can to cope with that.
So what type of advice do you have for people who are at home and they feel overwhelmed with anxiety and stress based on what they're seeing on the news and what they're viewing on social media related to coronavirus?
Yeah. So the first piece of advice related to the news is if you find that reading, watching, listening to the news makes you feel anxious, it probably makes sense to limit your media diet to once or twice a day. That should be enough for you to get any news you need to get, and yet not spend all your time just raising your anxiety level. You should also stick to credible sites like the CDC or the Rhode Island Department of Health. Those are good places to get reliable information. You don't want to follow every Facebook story down a rabbit hole because the news you get there, as we all know, may or may not be credible. And there's no point in getting anxious over something that may not even be true. Finally, I would say actively look for stories of inspiration or hope. So this morning I read a story about how scientists in our country, all over the world, are really looking at existing compounds, drugs approved for use in humans, to see if some of them might limit the impact of the coronavirus. And I felt very proud and hopeful when I read that story. I felt very proud of what many scientists are doing right now to help us.
Now, I know many people are at home following the guidelines set forth by the Rhode Island Department of Health, but what else can people do in addition to manage their stress?
Yeah, there's a lot of things that we can be doing. First of all, remind yourself, by following these guidelines, by social distancing, frequent hand washing, staying home when you're sick, you are contributing towards limiting this public health crisis. Another thing to do is to be kind to others and reach out to others. There might be people who are very lonely at home. You can reach out and talk to them. They might be your elderly neighbors. They might be relatives. It may be an elderly neighbor isn't comfortable going to the grocery store, but when you go to the grocery store, you could drop off groceries for them. So the more you focus on strengthening your relationships and reaching out to others, and that's an activity very much under your control, the less time you also have to focus on your own distress as well. And it really helps other people who may be feeling very lonely or distressed. You can turn to your religious community. Religious communities obviously have a very long history of supporting people in difficult times. There may be online options. I know that the priest at my local Catholic church, for example, said Mass by Zoom this weekend so that people could tune in. You can also check out online programs for managing stress. One good website is the Brown Mindfulness Center, and they do have some free options that you could check out. There are mindfulness apps that you might try on your phone, online yoga classes. So there's different things online that you could reach out to and try for managing stress as well.
We have a lot of people in the state of Rhode Island with a lot of free time on their hands right now. As we know, students are out of school, some people are out of work. So what can people do with their free time to manage their stress in a positive way?
Yeah, I think a big component is to structure your time. So your time should include time for work or schoolwork. If you're out of work due to this crisis, there may be things that you can do, like continuing education online, education for maybe a shift in careers that you haven't had time to work on because you've been working. You could work on your resume and certainly contact state offices remotely for things like unemployment insurance. I know that they are working on handling all of that remotely. So your time will include work and schoolwork, household chores, physical activity. Absolutely make sure you exercise. You may have time to exercise every day right now, so do it. Get outside if you can, keeping your distance. You want to include time with family and friends, obviously in person if you live with them, or via audio and video calls. Reach out to people who you haven't been able to talk to very often. You might create new family traditions at home. So my family, admittedly on the kind of nerdy side, and started to read Macbeth with another family via FaceTime. But there's lots of options for this. We've really been enjoying it. But there's lots of options for new traditions like this. And finally, you could start new hobbies at home or get back into ones you've not had time to do recently. So for example, a while ago, I learned to crochet entirely by video, entirely by YouTube videos. So your day should include a variety of different activities like this, especially including activities that are meaningful and important to you and connect you with family and friends.
People who are still in the workplace are taking additional measures to combat coronavirus, such as wiping down their phones and their desktops. But what else can people in the workplace do to manage this anxiety?
Yeah, so obviously if you have to go to work, you want to use social distancing. You want to call the person in the office next door, no matter how silly it feels, because you can really be a model for your colleagues. You want to be kind to your colleagues. You want to help everyone to follow guidelines without being mean or irritable about it. Obviously, you're not going to go into work if you feel sick. You want to do your best to focus on your work. When you get distracted, notice you're distracted and bring your attention back to your work. And you may need to do that repeatedly. One good thing about being at work is that it should, for many people, that really limits how much time they can follow news sites, which, as we talked about, may just increase your anxiety because you need to work. You need to not be on those news sites.
Tell us a little bit about how parents can speak to their children about some of their fears and anxieties related to coronavirus.
Sure. I think first you want to be willing to talk with kids about what they're experiencing. Just like with adults, telling them don't worry generally does not work. Instead, you want to talk with them about their fears and reassure them that you are here right now, today, to take care of them. For teens especially, you want to limit their access to the news. You want to minimize any discussion of your own worst fears or rumors or worst case scenarios. Again, they don't need to hear that. And if possible, you want to discuss some of those concerns with another adult rather than your teen. The virus doesn't seem to be hitting children very hard, and kids might be reassured by that information. Like with adults, you want to structure their day, including schoolwork, physical activity, time with family and friends via phone, family activities, time outside, doing chores. Maybe this is an opportunity for your kids to learn great life skills like cooking and doing their own laundry, and hey, let's wash the windows. But don't be overly rigid, as kids obviously may be struggling with their own emotions, but do try to have some structure in their day. And remind them that by giving up their favorite activities, by giving up playing soccer right now, or getting together with their friends, they are really doing their part to help their community get through this.
Tell us a little bit about how the 12-step program would apply in this situation.
Yeah. So first, let me acknowledge, since you mentioned 12-step programs for people with addictions, is that times of stress can be particularly tough for people who are recovering from addictions. So there are certainly online ways to connect with 12-step programs and other peer support programs, and that's definitely worth looking into if you are accustomed to going to frequent in-person meetings. I'll focus on a few of the 12 steps, which I think are particularly relevant now. Step 2 is that I came to believe that a power greater than myself could restore me to sanity. And step 3 is to make a decision to turn our will and our lives over to the care of God as we understood Him. So this really points out now is the time to really rely on our own spiritual beliefs as a guide and a rock through this crisis. Of course, we must do what's in our power to do, so following public health guidelines. But at the same time, much is not in our power. And that's always true. That was true a year ago. That will be true next year. That will be true 50 years from now. There's always a lot that's not in our power. And this is an opportunity to turn to God or to our higher power as we experience it for strength. Steps 8 and 9 are about identifying people we've harmed and making amends. So they're really about building genuine and meaningful relationships in which we acknowledge our own role with past difficulties and provide each other with support and build those relationships. And in fact, in the literature on something that's called post-traumatic growth, one of the things that can come out of traumatic experience is deeper relationships and a renewed sense of our connection to others. So now is definitely the time for reaching out to people via phone or video chat. And lastly, let me talk about for just a minute this idea of live one day at a time, one day at a time. This is so useful for all of us at all times. It tells us to focus on the present, on what you're doing right now. It also says, it might be overwhelming to think how long this could go on for. It could, because we don't know how long it could go on for. And just to think about, what if this goes on for a year? What if it's very overwhelming. So focus on getting through today, or focus on getting through this hour or this minute. You don't need to focus on getting through the year. You focus on getting through today, one day at a time.
Many times at Butler Hospital, I've heard you say that we need to be resilient during this time of high stress. Please give me an idea about the concept of resiliency and how we can build our resilience.
Sure. Resilience is very much the ability to adapt to difficult situations in positive ways. So how can we build resilience? Research shows that people who are resilient share some common experiences. So first, as we've been talking about, is social support from family and friends, and from colleagues, and from managers and supervisors. So we can all provide this support for each other. This is particularly important in a healthcare setting right now. So another common experience for people who show resilience is a sense of meaning and purpose to work or behaviors. And I think this is something we can really build in ourselves and our children and support in others. So we can choose to do things to help others in this time of crisis. We can express gratitude to healthcare workers, to grocery store workers, and other people who are essential for carrying us through this crisis. We can let them know that we find their work to be meaningful and important, and we are appreciative, deeply appreciative of what they do. A third experience or acknowledgement that people who are resilient have is that they accept that change is an inevitable part of life. So there's certainly lots of predictions and projections for the future right now. Of course, we need to take them seriously and use them to plan to avoid worst case scenarios. But we also have to understand that things are going to be changing constantly. And that, again, that was true a year ago, and that's true next year too. So that things are always going to be changing in ways that we can't always anticipate. And that people who are resilient work on accepting this and understanding that this is how life is.
And what resources would you suggest for those experiencing anxiety related to coronavirus?
Sure. So first, many therapists, mental health providers are finding ways to provide services remotely, so via telehealth. And in fact, a telehealth session could look a lot like this, where you may be having a video chat with your therapist, just like this. You're both in your own homes, in private spaces, being able to talk about what's going on. So if you have a therapist or a mental health professional that you work with now or in the recent past, you can certainly reach out to them. And as I've said, many are finding ways to do this work remotely. The other thing is that you can visit Butler Hospital's website at butler.org or call Butler Hospital's Behavioral Health Services call center, which is available 24/7 at 844-401-0111. And then finally, there are also crisis lines like the National Suicide Prevention Hotline for people who are thinking about suicide. And again, available 24/7, always something that you can call. They have a website. You can chat with them over the web. So the National Suicide Prevention Hotline is another good option.
Dr. Uebelacker from Butler Hospital, thank you so much for joining us today and for your great advice. I'm Raina Smith with Care New England.
Thank you for having me.